Hello, my name is Chris Gonzalez. I'm a trustee of the American Board of Urology and the chair of its Certifying Examination Committee. I'm going to talk today a little bit about the certifying exam and the process leading up to the certifying examination for 2024. I have no relevant disclosures. So what is the mission of the ABU, the American Board of Urology? Well, plain and simple, since 1935, our main role is to act to protect the public. How do we protect the public? Well, we want to make sure that our urologists are providing high quality, safe, and ethical urologic care. So we maintain and establish standards of certification for urologists, and we work with certified urologists to achieve lifelong learning so they continue to be certified. So a couple definitions I think we need to make sure that we're clear on, and they get mixed and matched quite a bit, are certification and accreditation. So certification is the process that we're talking about right now for board certification. So it's a process to make sure and assure the public that a certified medical specialist has completed an approved educational program and an evaluation by the board. It's designed to assess knowledge, experience, and skills that are very commensurate with high quality and safe care in that specialty. This is different than accreditation, which is a voluntary process of evaluation and review, usually done by non-governmental agency of peers. So the best example I can think of is ACGME and residency programs. Although it's not really a voluntary program, because if you don't have accreditation as a residency program, you will not get government funds. So what is the certification process? Well, it can take up to 6 years. And if we start at the far left, you want to complete an ACGME approved residency program either in the US or Canada. You then want to pass the qualifying or written examination. You've got 3 attempts to do that. You then want to meet requirements to take the certifying examination, and that includes log review, peer review, credentials, and a complication narrative. And I'll talk a little bit more about this. And then you can sit for the oral exam, which is what you're sitting for right now, and pass a certified examination. You got 3 attempts to do that. So what are the prerequisites for the certifying exam? Well, you need to be in practice for 16 months. Now, if you do a fellowship, you get a 4-month waiver, but you got to get written approval from the board, and that's only 12 months. Unrestricted medical license in the state where in practice and hospital privileges. You need to have review and approval of your professional responsibility action history. Favorable peer and practice log review. So peer review is going to involve your peers, but it's also going to involve leadership in your hospital or your department that will be asked to comment on you. So what about the practice log? Well, it's going to be 6 months of all office, hospital, ambulatory visits and hospital office procedures for each facility where you practice. So if you do at least 50 cases in a facility, then we're going to ask you for a log for that facility. Must be submitted electronically, and there will be instructions on how to do this. If the log raises any concerns, the credential committee of the ABU may ask for clarification, an interview, may defer your candidacy, or rarely require a site visit. Recertification candidates, lifelong learning candidates, continuing neurologic certification candidates, and subspecialty certification candidates all must submit a similar 6-month log. So what's the objective of the certifying exam? Well, the ABU considers the certifying exam to be an extremely important process and part of the board certification. It's the final check after everything else that you've done. And really what we want to do is determine your ability to gather information relevant to a clinical scenario. So that's interpreting H&Ps, diagnostic tests, and images. And then your ability to reach a diagnosis, apply everything that you've taken in to clinical problem solving, react in a timely fashion to complications, which is very important, and act in an ethical and professional manner. So what's the process? Well, you will be handed a case scenario with pertinent clinical information at the start of each protocol. You'll be given lab results, images, video clips potentially, and they'll be released to you at certain points during the protocols. All normative lab values will be provided, so you don't have to worry about having those on board. You'll be asked a series of questions then after this information is reviewed related to the evaluation and management of that clinical scenario, interpretation of diagnostic tests and images, description of surgical techniques potentially, management of complications, and interaction with patients and family members. The examiners move you along to complete the protocols. So they're going to move, and don't take that as a bad thing if people keep pushing you, because we have a lot to get through in the time period that we're allotted. So what's an OSCE? So an OSCE is an objective structured clinical examination. It's been shown to be a more realistic way to assess candidates' competencies. So there'll be 2 OSCEs on your exam, and each OSCE will test for a different competency. One's going to be for professionalism and communication. So you will have a simulated patient or an actor that will be in the room that you'll interact with. The other OSCE will be involved in interpretation of diagnostic studies, imaging, or a video clip, and then applying that information to direct intervention. No need to alter your study preparation for an OSCE. You've already prepared for it by going through a residency and what you're doing for these protocols. But again, we're getting at different competencies that we're not testing for the written exam or for the oral protocols. So in summary, the certified examination process, you'll have 2 sessions in 1/2 day separated by a short break. Each 50-minute session will have 1 protocol of 10 items. You'll move right to the second protocol of 10 items, about 20 minutes each. And then the objective structured clinical examination, the OSCE, which will have 5 items. That'll be about 10 minutes. Only 1 examiner will be delivering a protocol. You'll have 2 in the room. Examiners will not switch back and forth within a protocol. Examiners will change for your second session, which would be a replication of this, and all examiners score independently. So the examinations will be recorded, and this is just for us in case there's discrepancies in scoring between examiners. The recordings are destroyed once the results are released, and the results are released about 4 weeks from the date of the exam. The examiners are blinded to the training, part 1 score, peer review, practice pattern, and location of the candidate. Examiners are queried prior to the exam to ensure that they don't know the examinee, and you'll be asked prior to the exam if you have any relationship with the examiner, be it training program, visiting professor, or research. Scoring. So scoring is definitely in your favor. So it's a criterion reference testing, and it's used to determine the minimum acceptable pass level. So you think about the difficulty of the examiner, it's not a concern for a couple of reasons. The answers are fixed, objective, and clearly identified in the scoring rubric. And the examiner, question, and protocol difficulty are adjusted to reach a fair average. So if somebody is grading people more tougher than other people, that will be adjusted for. So you don't want to think because you got a bad draw of an examiner who might be a little bit tougher, will not play into it, and we'll reach a fair average for you. Scoring is done on a point system for each section within each protocol, in addition to an overall assessment. So failing to answer one section correctly does not affect the next, so just keep moving. And you'll hear that over and over again, is just to keep moving. If you think you missed something or you feel like you're being rushed, you just want to keep moving. Don't worry about what just happened. Scoring is objective and highly reliable from year to year. So where does this all take place? It takes place at the AIM Center, and this is the 3rd year for the American Board of Urology, and it's been working quite well. It's a 32,000 square foot area with state-of-the-art audio-visual, about 10 minutes outside downtown Raleigh, North Carolina. It's also home to the American Board of Anesthesiology. We've had a good experience there for the past 2 years. So this will be the room that you will go into. You can see the 2 examiners will sit across from the candidate. There on the computer, you will see the images that you'll be shown, or potentially a video clip, and you'll be handed the protocol in writing as far as the history and physical. You can write on that piece of paper as well, and you can take your time reading it and understanding what the facts are that are provided to you. So transportation and lunch. You'll be bused to and from the Renaissance Hotel to the AIM Center. Morning candidates must report about 30 minutes prior to their exam. All morning candidates will be sequestered until 12:30 p.m. Afternoon candidates must report at 12 and 12:30. Boxed lunches will be provided. So why not have a virtual exam again in 2024? Well, the board weighed the pros and cons and felt in-person exam was more reliable and fair. Multiple boards have noted lower scores on virtual exam, and we happened to avoid glitches about 3 years ago, although several boards did not. So we got a little, wouldn't say we got lucky, we were prepared for it, but there were quite a few glitches with other specialty boards. And really, we surveyed the candidates, and the majority of candidates prefer in-person exam on the surveys. 100% of those who did not pass felt the virtual exam put them at a disadvantage. So some of the specialties that have gone to virtual exams are coming back to live exams again for these reasons. The ABU has a DEI and committee, and the current chair is Cheryl Lee. All oral board examiners take part in an online implicit bias module designed to raise awareness of this. And the committee has begun the process of examining results of past exams in order to assess for any variances. And we've done this for gender and have noted no difference in the certifying examination results. And we're also keeping a very close eye on race and ethnicity data. COVID policy for 2024, all participants will attest to being COVID-19 symptom-free at registration the night before the exam. All participants must acknowledge that the ABU cannot guarantee that you will not be exposed to or contract, I should say, a communicable disease at the exam. Masks are optional. So words of wisdom. If you don't know a particular question, just keep moving. As we talked about, the scoring system is in your favor. Going back is not going to help. Just keep moving forward. And the overall assessment at the end is also something that's very important in the scoring process as well. So again, just keep moving. You may come to a part where you realize you didn't answer something correctly, and again, move on. Maintain professional behavior at all times. This is the only time the examiner will get to know you. So it's important that you keep yourself together during this whole thing. It can be stressful. But again, people get through it, and I'll show you why and how well people do. The overall assessment score for each protocol carries more weight than individual sections. So again, keep pushing forward. And again, I want to show you these exam results. This is from 2006 all the way to last year. Last year, 99% passed. The year before that, 97% passed. So again, the scores are good. You're going to do well. You prepared. You've gone to residency. And I wish you the best of luck in this process. Thank you.